Hi everyone and welcome back to my channel. For those of you who don't know, I make content relating to my active fentanyl addiction as well as my experience working in a prison. I worked in a male's life as prison and I was also with somebody who was incarcerated, so I have a couple of different perspectives. As you can tell by the title, this is going to be relating to my prison experience from working in there and specifically working in the healthcare sector. It's going to be a part 2 to the previous video, which I will link on the card. That one was discussing sort of the primary healthcare that's available to prisoners in the prison that I worked in, so the sort of physical health that's available, and this is going to be about the mental health support that is available to prisoners. So as I mentioned in the previous one, when somebody first comes into a prison, they will be assessed. This does also include a mental health assessment, so staff are aware of any conditions, any underlying mental health conditions, any medication or that sort of thing. As you can imagine, a lot of these prisoners have been through really traumatic things. They've had not very nice childhoods, most of them, so a lot of them, if not all of them, have some form of mental health issue. And sadly, there is not enough staff to go around for everybody. Because of this, mental health issues are missed and, you know, unfortunately people do take their lives, and this happened whilst I was in there. I wasn't on shift, which I'm really grateful for. But yeah, somebody did take their life and people attempted to very regularly. On top of this, people self-harmed a lot as well. So it was clear there was a lot of mental health issues. And I think it's something that was being addressed to a degree, but definitely a lot more could have been done. So similarly to the physical side of things, there are nurses. On the mental health side of things, there are mental health nurses. These go on the wings, they do assessments before referring over to the psychiatrist for medication. They will do sort of initial assessment, get some background, get some understanding of what's going on with, you know, the prisoner, have sessions with them, either go on the wing or have them come to healthcare and spend some time sort of unpacking what's going on with them, and also then supporting their diagnosis. So once they then pass them on and refer them to the psychiatrist for medication, psychiatrist generally just deals with the medication side of things. They will then, the mental health nurses will then support alongside that, so that, you know, it allows more time for the psychiatrist. There was only one psychiatrist for the whole prison and he wasn't there very regularly at all. He had a really long waiting list, so in order to help things move a little bit quicker, they had the mental health nurses to help support the psychiatrist, and it worked well because they were there 7 days a week, so they were there in emergencies as well. You know, at the weekends there was always a mental health nurse there, so if somebody was in crisis, somebody tried to take their own life, if somebody was severely self-harming, there was a nurse there that was able to help bridge the gap until the psychiatrist came in, you know, later on the week. I think he was only there 1 day a week. Obviously the physical health side of things, the doctors, they can prescribe medication, but it isn't their kind of field that they specialize in. So, you know, worst case scenario, they can prescribe medication, but the psychiatrist obviously knows a lot more about it than the doctors do. In order to support this, there's also a counsellor, and again, she had a really long waiting list and people, you know, need regular appointments with her, so it's really hard for her to see this person, you know, regularly, but then have time to see other people as well. She obviously worked alongside the mental health team, worked alongside the psychiatrist, and, you know, a counsellor's job is, as it says on the tin, same as it is out here, to counsel people through their trauma and spend some time with them and, you know, give them little tips to help them cope with things. And the mental health nurses obviously did that as well. They ran kind of sessions as well to, you know, mindfulness sessions to help people cope in other ways than relying on medication or drugs or whatever else it is that comes up in prison. They ran some sessions which I thought was really good. I didn't think that would be the case, but yeah, one of the mental health nurses especially, she was fantastic, and she ran those sorts of sessions, so that was really great to see. Alongside this, there is the drug and alcohol team. So obviously they were there for people to self-refer, people to be referred from members of staff, so officers or other members of the healthcare team, if they noticed or were told of somebody who was abusing alcohol or drugs, then they would be referred. You know, it's up to them if they engage or not, but most of them would, because if they're not, then it's clear that, you know, there is a problem. And unfortunately, if they don't engage, a lot of the time the officers are just going to, you know, punish them for having alcohol or drugs. So it's better to engage with the drug and alcohol team than leave it up to the officers. The drug and alcohol team, they would do urine samples, and again, if you didn't engage with this, it was clear as to why, so you had to engage. And often, you know, things would come up in those urine tests which would explain a lot of the behaviours and things that people were showing. So they were really, really useful tools to help understand what was going on in somebody's situation. They also did a lot of other things, like they did acupuncture, which I thought was really, really cool, to help people relax and to help people who were otherwise struggling, you know, with their addiction. I thought that was really interesting, that that's something that was offered. People could go into the office and they could give them acupuncture. I went in once and had some. It was really, really interesting, and I thought it was a really amazing thing that they were offering. So as you can see, the mental health team is quite a lot smaller than the physical health team, despite the fact that there's probably as much, if not more, people suffering with their mental health in prison than the physical health. One thing that I was also really happy to see was on each wing there was something called listeners, and these were prisoners but that were given a little bit extra responsibility. There were no issues with their behaviour and they could be trusted a little bit more, and these listeners would go around to people on the wing. So if somebody was struggling, if somebody just needed somebody to chat to, the listener, they could ask for a listener to come to their cell and they would just chat to them. And sometimes these would be people who would try and raise concerns and help them do what they can to make them feel better, but other times it could genuinely just be that they just want somebody to chat to. There might be something going on in their home life that they just need a little bit of support with, a little bit of help with, a little bit of a cry, a little bit of a rant, whatever it might be, and these people were there for them, obviously 24 hours a day. And again, something that I was actually pleasantly surprised about, because I didn't think that this would be something that they would have. And it was nice to see as well, because there was a lot of support on the wings for prisoners. If they noticed that somebody wasn't eating or somebody wasn't leaving their cell, like, it would be noticed by the prisoners. They would say, oh, so-and-so's not left the cell, or is he all right? Or they would be comments about people, and obviously the staff, they're not supposed to disclose confidential information, but it was nice that there were people that cared, and a lot of the time there would be people there that would help the prisoners. You know, if staff couldn't get to them, or, you know, if a listener couldn't, or a listener came and they noticed that somebody was struggling, there would be the support there from other prisoners. Absolutely, I saw it quite a lot, and it was really nice to see actually that, you know, these people who were in there for some of the most horrific things that you couldn't ever imagine, but I guess they kind of related to each other on a level with certain things, and it was really, really nice to see actually that they supported each other when it was needed, and even down to encouraging to take medication that they may not otherwise take. You know, if somebody went off to segregation because they were struggling with something, they would often ask, oh, how's so-and-so doing? Is he doing okay? Or if he'd moved wings or whatever. And it was nice to see. It was really nice to see. So I think the physical healthcare side of things ran a lot better than the mental health care side of things. And a lot of times the mental health care side of things can be a lot more urgent, because if people are in a state of crisis, they need that help and they need it now. There are wings that have a constant watch cell, and this is like a glass pane, so rather than having a door with just a little pane, it's fully glass paned, so they have a member of staff or 2 members of staff watching them at all times to ensure that they don't harm themselves or try to take their own lives. And they have them in 2 or 3 of the wings in order to obviously help those people that are in crisis, to help make sure that they don't do anything. But obviously, yeah, more could definitely be done on the mental health care side of things. I just felt like people suffered for a lot longer than they should suffer. Only so much can be done. I understand that to a degree, and also I just think genuinely the NHS needs to do a lot more on the outside as well. I've struggled myself for many years, and I struggled to get help even in a state of crisis. There was times when I was told, well, if you're leaving the house, you're fine, you're not in crisis. I literally feel suicidal. No, if you're leaving the house, you're fine. Okay. And this is why people do take their own lives. So in some ways, the prison system works because there are people there. You know, these people have gone through horrific trauma, probably a lot more trauma than a lot of us will go through in their life. So rightly so, they have, you know, mental health nurses, psychiatrists on hand. But at the same time, I think the NHS as a whole, in prison and out of prison, does need to improve for mental health. And it is definitely getting there. There is definitely improvements that have been made that I've noticed, but a lot more needs to be done. Again, I was told to wait 9 months for some therapy, which is ridiculous. And I know, you know, ADHD assessments and things like that can take up to 5 years for an assessment. It's depending on where you are in the country, but it's ridiculous. It really is. But more was available than I expected, absolutely. And I was pleasantly surprised with quite a lot that went on there. I hope that you guys enjoyed this video and potentially learned something, because like I said, I was not aware these sort of things were available for prisoners. And I look forward to seeing you in my next one. Bye!